Hey everyone, it's Dr. Locke from Ohio Mobile Chiropractic, just coming to you from the office in Avon Lake, Ohio. Real quick today, I just wanted to touch base with you about a unique hamstrings injury. Now, oftentimes, classically, we'll see a hamstrings pull and we think that muscle's really tight, so it needs to be stretched. This isn't always the case, however, and what we really should be focusing on is how good or how well does that hamstrings function. What's the firing capacity of those hamstrings muscles? I had a patient this past week who presented with pain near the attachment to the pelvis, to the ischial tuberosity, and this site was very tender to palpation. It was very sore. But when we tested the function of these muscle fibers, they were terrible. Failed the test immediately. Could not produce the resistance or the firing capacity that it should have. Now, if we went ahead and stretched that dysfunctional muscle, we would have made what little function it had even worse, which is simply going to compound the problem. It's going to delay the recovery process, and it could possibly lead to further injury. But what we did find was the fibers of the hamstrings that attach down by the knee, the distal fibers, those muscles were really powerful. They were generating a lot of force. And when we compared the two sites, we discovered, using the neurokinetic therapy protocol, that the distal fibers, where the muscle attaches down by the knee, were actually compensating for weakness in the fibers up by the attachment to the pelvis. In this scenario, the weaker fibers eventually succumbed to an injury from an overstretch. They didn't have the strength to be able to tolerate the position that they were in, and as a result, they ended up with a strain type of injury, which is a partial tearing of the muscular tissue. And that was all caused because there was overfunction of the hamstrings down by the knee and underfunction of the hamstrings at the attachment on the pelvis. So we assigned some corrective homework to kind of undo this pattern. The patient's going to be off doing homework for the next 1 week or so, and when they come back in, we're going to reassess and see if that pattern has improved. And I do anticipate that the pattern will have improved and the pain will also improve. We're still going to need to work on the overall function of the hamstrings and make sure all parts and pieces are correctly firing. So we need to focus on getting the pelvic attachment portion of the hamstrings as well as the knee attachment portion of the hamstrings to be fully functioning, and then we'll be able to release that patient back to their activity. So just because a hamstring is injured and it feels tight and sore doesn't necessarily mean that it needs to be stretched. We need to assess the overall function of that hamstrings before we decide what needs to be stretched and what doesn't. If we stretch something that doesn't have very good function, we're going to make what little function it has even worse, possibly compounding the injury and even possibly leading to further injury down the road. Hopefully you guys enjoyed that little insight and summary of possible hamstrings injuries. If you know anyone with the hamstrings injuries, have them give me a call. I'd love the opportunity to take a look at that specific injury and find out why it happened in the first place and come up with a proper treatment protocol to get them back in action. Have a great day, everyone.